I definitely have a history in science. I grew up as a scientist and was in science for probably 30 years. Before I realized that corporate America isn't for me and the pharmaceutical industry isn't for me, I have my own medical history, and that's how I got into Chinese medicine. Got some tremendous help from Chinese herbs, thanks to some fantastic masters that I had access to. Not every practitioner knows what they're doing. Then, I actually got some Chinese herbs and they fixed my stomach and then fixed my back pain, got some acupuncture. And I'm like, this is just mind blowing. I have to do it myself.
All right. Hey, thank you so much for coming to the Medical Entrepreneur Podcast. We have a very special guest with us today. We have Dr. Richter, Dr. Hans Richter. Dr. Richter, could you tell us a little bit more about your backgrounds and a little bit more about, kind of what your approach is to medicine?
Yeah, thanks for inviting me today. Very exciting. And I definitely have a history in science. I grew up as a scientist and was in science for probably 30 years. Before I realized that corporate America isn't for me and the pharmaceutical industry isn't for me, then, I have my own medical history, and that's how I got into Chinese medicine. Got some tremendous help from Chinese herbs, thanks to some fantastic masters that I had access to. Not every practitioner knows what they're doing. I actually got some Chinese herbs and they fixed my stomach. And then I thought, why not fix my back pain? Got some acupuncture. And I'm like, this is just mind blowing. I have to do it myself. And the interesting thing is, I never really wanted to be a doctor, but this is different, right? And it's really hands-on. And immediately, in Chinese medicine school, you are in contact with patients. And that's one of my biggest criticisms actually about how the system is set up. I call it, pharmaceutical triangle of death, where there's literally an effort made that a scientist never sees a single patient. So in 30 years of science, I've never seen a single patient or talk to a MD practitioner. And then, the MDs are practicing doctors. Most of them never really read science or even fully understand them. And that all feeds into the system of big pharma. And that's how we ended up with this mess. I definitely am a Chinese medicine practitioner with a lot of passion though, because this medicine works. And it's really not that difficult. It's sometimes difficult to explain it to patients, but most of them get it after a while. And I have to say, I almost got kicked out of Chinese medicine school because I need to unbrainwash myself. And that was part of the process. And that's the process that my patients are going through. Now, I recently added stem cell therapy to my practice about 5-6 years ago. I always realized there was, something important about Chinese medicine. We talk about the Jing, or the essence you're born with. We can regenerate that, and we can definitely add more lifespan to your lives now, thanks to some modern medicine and research, but it is a natural therapy at this point, and that's why I love it and add it to my practice. And then I was still thinking there's something missing. I knew there was something missing. Lucky 3 years ago, a German colleague got me on this path of omega-3, and that has been my passion since. I wrote a book last year, Nourish and Flourish, Fat That Fuels Us, which, by the way, is written very interestingly with the background story of Huckleberry Finn, not to make it so scientifically boring. I thought it's written very well for the average person, and many people find it interesting. It's really it's almost like a pet now, omega-3. I'm so passionate about it. So in Chinese medicine, I actually call it the yin and yang of fat. And there's a chapter of that in my book. The yin and yang of fat is basically fat is what rules our metabolism. Fat is what rules everything in every single cell. And the reason for that, of course, is that it's all about the cell membrane. And the cell membrane is what actually keeps us alive. And that's what I was doing in my 30 years of science. I was actually working on the crystal structure of membrane proteins, receptors, rhodopsin, right? Similar to the rhodopsin that helps us visualize things. And so the cell membrane cannot function without proper omega-3, neither can the proteins in it, channels, receptors die. Mitochondria can't make any ATP. Your neurons cannot send off vesicles to communicate with each other. The shocking thing is that I did not have a clue of how important omega-3 really is after 35 years of science. And I write into my introduction in my book that was the first thing that I did in the lab as a student. I analyzed fat sample for arachidonic acid on one of the first HPLCs, on one of the first PCs, which always crashed, but we had a good time in those days. Little did I know anything about omega-3 35 years later. So obviously we were working on arachidonic acid for another COX inhibitor, NSAIDs. And that's, not really what it's about. It's about balancing out your inflammatory omega-6 with anti-inflammatory omega-3. We grew up as hunters and gatherers for 200, 300,000 years, eating fatty red meats that were grass-fed or fresh fish, which essentially gives you a 1-to-1 ratio of omega-6 to 3 in your membrane, in your cell membrane, right? Now, we know from 1 million tests performed worldwide that it will be testing over 25-to-1, 30-to-1. Kids are over 50-to-1 now. We're not quite sure why, but there are some ideas about it. So every time a cell breaks down in your body right now, it will be 30-to-1 inflammatory message. Simply, there is 90%, 95% omega-3 deficiency, and it cannot turn off the inflammation ever. So an inflammatory curve normally goes, like this. You're supposed to turn it on, and then you're supposed to turn it off within 24 and 48 hours. And that doesn't no longer happen. No, the inflammation just keeps going and going because the message is 30-to-1 inflammatory. Everybody's aware of the omega-3 problem, or a lot of people are, but I would say 2 out of 3 patients walk into my office are aware of it. Many of them are taking supplements, but we know from our 1 million tests that they're all rancid. There's only 3 products in the world that are not rancid.
What happens if the product is rancid?
Yeah, that's an interesting question. So I myself tried it out. Simply, you just open one of the gel caps, put it on a plate, smell it. It's nauseating. So many people have a very tough stomach and they can just ingest them and they kind of feel like, some people, they actually get the burping and indigestion from it. And that's how you know it's rancid. Your body just rejects it. It doesn't like it. And by the way, rancid omega-3 is harmful. So it contains omega-4 and other downstream products, oxidized products. The situation is absolutely dire. And again, we've done 1 million tests worldwide, and I have personal experience from my hundreds of tests now. Just got a person in who took Costco brand for 6 years, diligently, says every day, and the whole test is read. All of that, by the way, is explained on my website, omega3health.us. And there's examples of tests. I mean, I could probably talk hours and hours now about omega-3. And inflammatory is just one little aspect of what it does. So it's a multitude of things that omega-3 does, but the main thing really is inflammation, balancing out your arachidonic acid with EPA is the name of the game. So again, most people, first test is 90% EPA deficient. If they have taken products before, it might go down to 70, sometimes 55% I've seen. So there's a product over the counter, Nordic, that kind of works, but I've never seen anybody better than 50% deficient with these products that are available. Now there's 3 products in the world that we know work. And these products give you a 100% balanced EPA. What does that exactly mean? If you look at the research, and my website is loaded with it, there's thousands of research studies, clinical studies. They all say, you can get rid of modern disease. We call it metabolic syndrome, diabetes, high blood pressure, all starts with kidney disease, early kidney disease, liver disease. You can get rid of them by supplementing. And when does that happen? When your omega-6 to 3 index falls below 4 to 1. Again, we started out at 25, 30 to 1. By the way, traditional fishing countries like Norway and Japan are testing over 10 to 1 as well. There is no more possibility to avoid omega-6 in our diet. And that's why they're testing high too. The only people who are doing a good first test are basically fishermen or call them Russian caviar dealers. So raw is full of omega-3 and it's not frozen, right? The name of the game is it can't be frozen. You'll lose it. Or what do they do to a grass-fed cow?
No.
They put them on a feedlot at the end of their cycle. So you have to buy a $15 tiny little piece of grass-fed, grass-finished beef. Grass-fed, grass-finished is the new term. Unless you have access to local farmers and stuff where you know what's going on. It's literally impossible to get omega-3 by nutrition. That's why a stabilized fish oil is the best choice. We have omega-3 from algae too, of course, but there's nothing like the stabilized fish oil. And here's the key. So why are these other products rancid? Because they're not stabilized. So the manufacturer measures omega-3 and then they could care less what happens on the shelf. Same for all of your other oils, of course. Canola oil, for example, does contain a little bit of omega-3, but by the time it stays in a clear bottle on your shelf, there isn't any left, and it's 90% inflammatory omega-6. So,
Wow.
All of that said, I work with these 3 companies, and the one I like the best, the Swedish company, they are adding 30x concentrated phenolic acids. Phenolic acids from olives are extremely important and they're highly potent, and they managed to stabilize the fragile omega-3 for a long time. So these bottles won't turn rancid in several months. And it's really a miracle that this company has been formed. It's the fastest growing supplement company right now. They have 50% growth every quarter. And really the trick is that we have third-party independent testing that comes with the product, so you know it works. And their proprietary phenolic acid stabilization method, which is really groundbreaking. For myself, I didn't actually start out so bad. I was only 7-1 inflammatory 3 years ago. I eat pretty well. I never eat any processed foods. Well, never say never, but I definitely can say that I'm eating pretty well. I like liverwurst. I like canned sardines. So I attribute that a lot to that. And again, the salmon has to be fresh. Once it's frozen, it's not good anymore. Farmed fish, of course, doesn't contain any omega-3 because they fail to feed them with proper algae. And that's where the omega-3 comes from, by the way, algae.
So most of the fish sounds like so basically omega-3 is critical to keep inflammation down in your body, just to kind of take a step back. And then pretty much.
It's the number one thing, and it's not the only thing that omega-3 does. There's so many things it does. But the number one thing, it's all about inflammation. And we know that all diseases are inflammatory. They all have an inflammatory component. Osteoarthritis, for example, it stems from leaky gut. So the first thing your omega-3 will do is repair your stem cells in the gut. And that, by the way, is a very interesting phenomenon. So we test the red blood cell membrane, and these cells turn over every 4 months. However, the test needs 3 years for an average person to come below 2-1. So they mirror the entire stem cells in the body. And so it takes 3 years to exchange all of your organs. That's why they say it takes 3 years to develop a good habit once you exchanged every cell. And unfortunately, most people give up after 1 year. That's really just when it gets interesting. So your heart only exchanges max about 5% per year. It's a very slow process. Your kidney is even slower. The cardiovascular system is actually taking a good 2 years to exchange with proper omega-3. I was saying I started out with 7-1. So that ratio doesn't necessarily mean everything. You have to look at the detailed analysis of all the 11 fatty acids we look at. And of course, you can verify these tests by other parties, LabCorp, to name it, as long as you look at the membranes, right? Not liquid blood. So that's the key here. And my EPA was still 65% deficient. So even with the 7-1 ratio, the body artificially lowers arachidonic acid. When he has too much, he just gives a negative feedback. Once, a year was around, I was 3-1, 3.5-1, up to 79% EPA. And now, 2.5 years into it, over 10% of my membrane is omega-3. So here's the crux and the clue. I was mentioning studies earlier. Why do some of the studies show that omega-3 has no effect? All of the fish eater studies show an effect. All of the supplementation depends on the quality of the product, as I mentioned, and it depends on how long people have been taking it. Most of them are much too short. However, once a study contains the omega-6 to 3 index that I mentioned, and it's easy to measure, right? Once you look at that index in the study, there's a 100% correlation of outcome. So that's why I was saying metabolic syndrome, etc., they all disappear once your index goes below 4-1. And that doesn't happen overnight. That doesn't happen in a 6-month study. It takes a full 2 to 3 years before your stem cells have proper omega-3. 8% is what the threshold is. And there's a threshold doses. There's actually been a recent article that I just put on my website. They actually made an effort to really look at the dosages and where the threshold is. And once you are above the threshold with a non-rancid product or, fresh fish or whatever you want to do it, you can basically really get a much quicker effect. And you have to reach that 8%. And that's about when you reach 8% in your membrane, that's about when the index goes below 3-1, 2-1. And that's when you're in the green. You can even turn negative theoretically, but I haven't seen that yet. It's important to get tested yearly. The question is, why is this omega-6-3 index test not part of regular blood work? And I only have one explanation for it. They don't want to see it. This test is basically on top of all inflammatory markers. Everything else follows. Once that test goes below 3-1, all your other inflammatory markers go down. You can look at my website. It's full of inflammatory markers that are going down with proper omega-3. Cortisol, for example, goes down by 20%. Not you don't want to get rid of cortisol, but you want to get an average decrease during the day, right?
That's huge. 20% is big to decrease.
Yeah, considering we need cortisol, we need a spike in the morning, right? But we don't want to be in fight or flight all day long. So what's happening in Western pharmaceutical medicine? It's all about reducing that inflammation, which traditionally is done with NSAIDs. And what do? They block the so-called series 2 eicosanoids. So that's what I wish I could share my screen with you. Then you would see the eicosanoid cascade. You could definitely have a better understanding of how omega-3s get converted to arachidonic acid. Omega-6 get converted to arachidonic acid, inflammatory. And so here you can see the book I wrote last year. So it's written for the average person, like I said, with a nice background story of Huckleberry Finn. That kind of picture works. Him floating on the Mississippi River, eating fish. And he's a smart guy, right? He's a very smart cookie. You click then on science and studies. And there's a little bit of information here on the first page, and you can actually get to the information there. But if you click on the science, you basically see this is how the test looks like. You have the traffic light presentation like we all do now in modern tests. All red for most people. The arachidonic acid is many times is actually still green for people, which doesn't mean a whole lot. But here's the index, right? So I've seen everything up to 70%, 70-1 inflammatory. So this gives you a 0% protection value against antioxidants. Very low mental strength because you can't really communicate your neurons. And it's all about cell membrane fluidity, which is about the cardiovascular system. And this is the index I'm talking about. So most people test below 3%. And 8% is the threshold. That's when disease disappears. So I have a full table of contents here. Let me see if I can get to I think it's this one here. All right. So here we go. So you see an example of the omega-3 portion of it. And you see that the EPA is 93% deficient and DHA is 73% deficient. So that's why they only add up to less than 3%. And here's the icosanoid cascade that I was talking about. So on the right, you see the omega-6 family. That is the inflammatory family. So linoleic acid gets converted to arachidonic acid, and linolenic acid, which is basically in flaxseed and some plants or nuts, gets converted to EPA and then finally to DHA. Many people think they can supplement themselves with flaxseed. And what we see in our tests is that you have 70-80% positive linolenic acid, alpha-linoleic acid, and you get zero EPA out of it. So these enzymes don't work anymore. Over 50, 60 years old, there's no more conversion. However, they still do work on this side, making a lot of arachidonic acid. Most people, I will show that in the second test, with over 13% arachidonic acid. Bottom line is over 30% of your membrane is omega-6 typically, and very little of it is omega-3. This is the series 2 icosanoids I'm talking about, and this is where the NSAIDs are blocking with the COX enzymes that convert it. So all of these prostaglandins and thromboxanes, they are basically telling your macrophage 1 population to keep inflammation. So they're cytokines that turn on inflammation. Does that make sense to you?
Absolutely.
Yeah. And the counterpart are the series 3. So once the cell broke down, they should get released and converted to prostaglandin series 3. And their job now is to turn off the inflammation. So somebody actually made an effort to really look at this process just recently. A publication came out. And again, since you have nothing in your diet anymore that can turn off the inflammation, this series keeps going and going. It will never turn off. And you have high levels of inflammatory markers, TNF alpha, IL-6. The counterparts like IL-4 are not getting made. So there's a lot more that omega-3 does. I could talk hours and hours, but the DHA, of course, has many more functions in the brain, especially when it comes to receptors and channels. These channels, the best example is actually your mitochondria, the cytochrome C. So the cytochrome C and the mitochondria is basically absolutely reliant on, so there's a whole section on mitochondrial health, and all the studies have their links attached to them, basically rely on the DHA function. So when the body doesn't have any DHA, it just takes omega-6, which is inflammatory. So now when you have a heart attack, right, your cells break down and they cause massive scar tissue. If you had 10% omega-3 in your heart, you would actually have a much lower effect. Same for brain injury. If you have a traumatic brain injury, 100,000 years ago, that wasn't so traumatic. If somebody beat you over the head with a cloud, you wouldn't get hemorrhaging states that you get nowadays.
Well, could you maybe tell, so if imagine I'm a physician, I have a practice, and I hear what you say about this omega-6 to omega-3 ratio. And when I pull it up, PubMed, there's all these studies indicating how important it is to have a good ratio of this. Obviously, the smaller ratio of omega-6 to omega-3, the better. And the thing is, like, what would you say is like a good example of a patient who has an omega-3 deficiency? How would you identify them in your clinic? And then what do you feel is like, when should you intervene? Would you also recommend, using supplements? If so, what brands you recommend, et cetera?
Yeah, I mean, again, there isn't a single good test. It's shocking. And there's 3 products that I mentioned are working in the US. It's only really Zenzino, which is on my website. That's the one I'm using. I know it works because of the 30x phenolic acid. Then there's Norsan in Europe. There's also another one, Ecology, but I don't really like it because of its antioxidant. There's another one, Biotics, from the Southern Hemisphere. I don't really like it either because it has acetyl palmitate in it, an artificial antioxidant. Really, the choices are very slim. I've seen some decent results with, and Nordic cod liver oil is pretty famous. So the EPA deficiency is still 50% on that oil. I have never seen any test where you had a proper EPA intake. And again, the only people who test well naturally are fishermen because they have access to fresh fish every single day. So after about 9 to 12 months, you will be in the green, and your index is basically supposed to be over 8%. That's the name of the game. That makes sense now?
It does. And then could you maybe give some examples of like, a patient comes in, what would you think is like the number one symptoms that you would see for somebody who is suffering from having a bad omega-6 to bad omega-3 ratio? Obviously, they're going to have inflammation, right?
Well, yeah, I mean, it's hard to explain this to people. In Chinese medicine, I actually talk a lot about, we call it yin deficient heat, which is low level inflammation. So it's not full heat where you are just blazing, you have whatever, a huge rash, or you have a rheumatoid arthritis or a fever or something. It's like low level inflammation. We talk about it a lot. And so yin deficiency. So what is the most yin? To me, it's omega-3. And so we see that a lot. And the symptoms of inflammation, I think, are clear to everybody. Everybody's aware of it. So we know that cancer, diabetes, again, it's metabolic syndrome. They're all related to inflammation. And nobody knows how to take care of the inflammation. They just pop an ibuprofen and think the world is good. No, it's just like putting masking tape on a check engine light. I wanted to point out this arachidonic acid index here, right? So again, that's your inflammatory omega-6. After the initial vaccinations and pandemic, we saw a lot of low levels. So there's still a few people here and there that are turning in a low level, which means you're autoimmune. So there's a range. You have to have a certain range of arachidonic acid because some inflammation is good, right? But I'm telling you, most people are right around 13%, which is continuous inflammation. And, we know from tests with mothers and babies that the baby sucks out the last DHA molecule out of the mother. So this is a mother in her 3rd trimester. So by the way, these values should all be 0, 0, 0. So 0 deviation. This mother was previously 0. And in the 3rd trimester, she turned -16 and then -40, just so the baby can get to 0. It desperately wants to balance his nervous system, develop his nervous system, right? DHA is so important for the brain development and nerve development in a baby. But the result is it still ends up with 82% EPA deficient. So we now put mothers on a double or even triple dosage. How do we know? We test in the 3rd trimester.
And so basically, just to reiterate again, essentially there's two companies that we know of that doesn't have rancid omega-3s. Everybody else essentially does. You mentioned before that it was, you talk about the Nordic version of cod liver
Nordic
oil.
cod liver oil.
Is there a certain brand that you recommend? Is there a certain brand you recommend? Because I'm looking here at Amazon and there's like all sorts of Nordic cod liver oils from different places.
Definitely. I don't have much experience with it. All I can tell you is that it still will not balance your EPA, but that is the best brand, period. All other ones I've tested are all rancid, including, by the way, pharmaceutical prescription Vascepa. The way you know it, you just open up a pill, let it sit for a minute, smell it. You can smell it's nauseating. I mean, if you don't smell the rotten, it's not the same as rotten fish because that comes from bacteria, but you can smell rancid. It's definitely easy to do. And Zenzino, you can't buy on Amazon. It works on a subscription model. Why? Because it's basically one bottle per person per month. And are you going to come into my office in 30 days and replace your bottle? No, you're not, right? So it has to be shipped automatically. Otherwise, you're not taking it every day. And the way I'm taking it is with a shot glass of water. I keep that shot glass at my dinner table. That's how I remind myself. And then if I wash the shot glass, I replace it. So same thing as brushing your teeth. What's the hard thing about taking supplements? You don't get
remembering. Yeah.
Yeah. So you have to find a way to trigger your brain. And no, it's automatic and like, Wismar. And I absolutely love it. So I can only tell you after a year, I started noticing the differences. I can know, right. And by the way, I have a whole website on athletic performance here, which I gave a big talk about lately. You can basically get way better performance, and people are breaking records at high age, especially cyclists. You can definitely at older age still perform better. You know, I can only tell you that I am riding bike, pretty much 3 months out of the year when it's nice here, and the hills are steep. So previously I had to stop about halfway on the hill. I better stop or I have to call the ambulance kind of a thing. No, I just go through. And the funniest thing is I'm zero sore. I'm zero sore the next day. I am so incredibly strong now. I like to do these experiments where I just chainsaw and chop a cord of wood and stack it in one day. Previously, I would be out with back pain which, by the way, is inflammatory. So I'm convinced in my clinical practice, back pain is 95% just inflammatory gut nature. How do you know it's burning pain? It's not really related to a disc problem, which, by the way, omega-3 can restore the nucleus propulsus in the disc. That's also on my website.
Wow.
It's all about aerobic, right? You want to be as aerobic, as long and as good as possible. I told you before, the mitochondria don't make any ATP without omega-3. And what happens is when you turn anaerobic, you have to use lactate, not because of the soreness problem, and that lactate doesn't make you sore, because you have to recycle the NAD for the glycolysis, which is very inefficient, right? So once your mitochondria are super efficient, you're making a lot less lactose dehydrogenase, and that's what you can see in all of these studies.
And I found this in Zeno online, so I can see that it looks like there's a thing called Balance Oil, 300 milliliters.
Exactly.
Okay.
It is by weight, but literally it's one bottle per person per month. It's about how long you take it every single day. It's not about how much you take per day or whatever. You just have to take it every day and incorporate it with a good meal. It's very complicated, by the way, to digest oil. Or fat in general. It's not a trivial process. So here's the cardiolipin. Many people know about cardiolipin. Have you heard about it?
Yeah.
Yeah, of course, right? I mean, it has 4 unsaturated fatty acids, right? And why is that? Because the inner mitochondrial membrane needs to be extremely flexible and it cannot be stiff at all to incorporate these complicated cytochrome C and ATPase molecules, right? When the body doesn't have any DHA, it has to suffice with omega-6. Our studies have shown, it's really hard to put everything on my website. It's probably in another section on the general science, but studies have shown when you take out DHA, it literally kicks out the cytochrome C, and the cytochrome C gets recycled into the cell through the inner membrane, outer membrane, and the whole cell undergoes a process called ferroptosis. And the omega-3 is an integrate component of keeping cytochrome C and ATPase happy. It also channels, very important. Article over article show what happens when you remove omega-3 from the channels. They cannot open potassium channels. So again, the human body is built extremely resilient and we are able to function in very little. But this is the reason why people have heart disease, because literally you cannot make enough aerobic energy. Your membranes aren't fluid and the membranes turn inflammatory because of the high index. So the name of the game here really is to get as much omega-3 into your heart as possible, which is very slow at a higher age. And again, I come to the same problem. A lot of people, if not most, quit at 1 year. That's just when it gets interesting. That's when I notice the effects. If I would be, really measuring my performance, I'm not really an athlete, but you could probably tell that. And that the oxygenation of the muscle and all that can be tested. So your performance goes up. And we do treat a fair amount of athletes, just not enough of them. So that's basically all I have to say about that. I mean, it's a very fascinating story, and you can click on each of these articles and read through it.
And so could you maybe give us an example of a patient that you're able to basically help because their omega-3 ratio was out of balance?
Yeah. So I've been doing this for 3 years, right? I wish I would be doing this for 30 years. I have yet to see people holding up for 3 years. I have a few people, a handful, which I know going into the green area, the green test area. So it's just about getting interesting. However, I would love to correlate like a 1 year or a 2 year test with other inflammatory markers from the blood work. It just rarely happens, though. I don't have enough data on that to really put it together, but that's how you could do it. Most people go to naturopath or ND because they are interested in functional medicine, blood tests, right? It's easy to do, and you definitely can correlate these values. And, when you show the patient, not only your index gets better, but all your other blood gets better. Ask me again in 2 years. I'm working on people with diabetes, advanced diabetes, and obviously adding the stem cells to that will be a big issue. So I have a definite passion about this, and I know I will get the long-term results, but realistically, what is the percentage of patients that really stays with you long-term over the course of 10 years? It's not a lot, right?
Yeah, I imagine it depends on your practice, but yeah.
Yeah. So here we have a very interesting study on um, only 4 weeks of supplementation basically brings up your DHA and EPA. Study in older people. It takes longer, right? But eventually they actually end up at the same FSR rate. So they just need a higher protein dosage. So even at 70 years versus 22 years, right? You can see quick results building muscle with omega-3.
Wow. So basically, anybody who's taking any kind of mainstream omega-3 is probably taking rancid. The brands you recommend are Zenzino, and then you'd mentioned before another brand that's related to cod liver. Do you remember the name of that brand?
There was Nordic and then
Nordic?
Ecology.
Okay. And then Ecology. Okay.
Yeah. And then there's biotics, but I don't like taking artificial antioxidants.
Gotcha.
I think that's not something I want to put into my body. We don't know the long-term effects of that.
So is it Nordic Naturals, which is the one that is working the best for those people, or do you recommend
Over the counter that you can get in the store,
Okay. Is Nordic
But
Naturals?
once again, it's not going to balance your EPA.
Okay. So in order to balance the EPA, do you recommend the Zenzino, or what do you recommend?
Yeah, I highly recommend not wasting your time. I understand that the subscription model it turns people down, but there's no other way to do it.
Yeah, I mean, makes
Plus,
sense.
you need the education from somebody to tell you how this works. So here's another example. Zenzino sponsored a whole first league soccer team in Norway. And I mentioned to you that they have a 10-to-1 inflammatory index in Norway. I can show you the world map. Athletes are worse, right? Because they burn DHA like there's no tomorrow. And so they all tested very high. I think the average here is 15-to-1 deficient. There's only 2 people here, right? After 6 months, and that's the beauty about being young, the entire soccer team, except for 3 people here, probably didn't take the oil, are below 4-to-1, 6-to-1, 4-to-1. So that's how fast that can go in younger people. And by the way, this team has since won the Open Cup in that country and has been in the top 5 teams since then.
Can you also mention, before we run out of time here, where does someone find your book? What's the name? How do they get it? Can they buy it on Amazon? If we want to learn more, what's the best way?
It's available on Amazon. I mean, if you go back to my front, Nourish and Flourish. And again, it's written more for the average person, not for but there's a fair amount of science. It gets harder at the end and everything is referenced. There's 150 references in there. For somebody who's watching this podcast, it's far easier to just go to my science page and just click on the table of contents.
Gotcha.
And just basically, look up whatever you want. I suggest to start out at introduction, why we're in this dilemma, and what's good and bad fat. So interesting, what actually contains omega-3, what doesn't. But the reality is we cannot eat enough plant or food sources to really up our omega-6 to 3 index. And here's the, metabolic syndrome, right? So that's what I was talking about. Abdominal obesity, high blood pressure, diabetes, which, by the way, the only good blood test in normal, blood work is triglycerides. So cholesterol is the biggest lie in human history, which I have put on this website. And so we should have a whole separate talk just on cholesterol. It's very interesting. So the triglycerides are basically fragments of undigested fat, which are very high when you turn inflammatory. And in the end, this is all about the arrival of good fats in the liver. And turns your diabetes 2 into a problem, and you're making sugar by gluconeogenesis. And that's where metformin kicks in. It's not a pancreatic disease, it's a liver disease, right?
Oh, I just wanted to ask you, so if there was actually a physician who's like, hey, I really want to add this to my practice, I wanted to study with you, Dr. Richter, can they reach out to you? And do you offer any kind of training for providers to become more of a holistic or learn some more about, Chinese medicine, how to treat patients with alternative therapies?
Oh, absolutely. I would love to train anybody. Physicians are a little bit tricky because they're not allowed to sell anything, right? Except for prescribing drugs. And so then, it gets a little more tricky, but you can buy this anywhere else from someone else. It's all about the training, but the reality is that an average physician doesn't care. And so I give you an example. I had a rheumatologist in here a week. No, it's like 3 weeks ago. So I was really excited. I told her, no, we should really get together and discuss inflammatory markers. And she flat out told me, I don't really do that. So,
And all of our patients are suffering with terrible joint pain, but
I mean, if one person needs to look at inflammatory markers, isn't that a rheumatologist?
I would think so.
I mean, I know how they make their money. They just, throw Humira at everyone and get a kickback on that. So how do I know? I know it firsthand. I mean, people have frivolous prescriptions of Humira, which, by the way, it's a fancy NSAID. So Humira is an antibody against TNF alpha, and the body isn't stupid. It actually makes antibodies against an antibody in a fair amount of time. So 30-40% of those people taking it are just blocking it with their own immune response. It's hilarious.
Wow.
Straightforward. You read the studies there. Once you look at the index, right? You have to look at the index. And by the way, not too long ago, 2 or 3 years ago, Cochrane, right? It's the biggest medical review there is, right? 700 pages on omega-3 supplementation. Not a single mention of the omega-6 to 3 index in those 700 pages.
Wow.
I'm not kidding you. And that was like 2 or 3 years ago.
Well, man, thank you so much, Dr. Richter, for coming on and sharing this information about omega-3. It's been very useful and definitely informative. And I appreciate you also showing your book and then letting us know more about this ratio is so critical for people's health.
Yeah, it was my pleasure and my passion. And, I can only emphasize that get tested. Without the test, you don't know how bad the situation is. And you have to educate people. It takes 3 years to exchange your stem cells into healthy cells.
That's true. Well, thanks again for coming on the podcast. Appreciate it.
Awesome. Thank you so much for inviting me.